Welcome to Buffalo Soldiers Fort Bakersfield podcast. We'll be speaking today about a topic that has made more news in our country than any other, and that's COVID-19. And we have with us our Commandant, who is recovering from COVID-19. So Commandant, may I begin by asking you some questions?
Absolutely.
Is it like?
That's almost a hard question to answer. I've been asked that a lot, and it goes through so many different stages. At the very, very, very beginning of it, I thought perhaps I just had a cold. It didn't. It got worse. And it got worse to the point where I found myself staying home and not doing things that I would otherwise be out in the community doing. And on one particular morning, I awoke and discovered that I was having a real hard time breathing. Now, I should preface this by saying I already have COPD. I already have asthma. I have these allergies, and I'm 77 years old. So I am the prime candidate to get COVID-19. It just seems that if anybody's going to get it, they say it's the elderly and the people with compromised immune systems, and that would be me plus two. So I didn't really think about COVID-19. The first thought that came to my mind was when I got to the point as the day progressed where I wasn't able to breathe at all, literally almost not at all. And I thought at that point I was on the phone calling my wife and begging her to please get 911 here because I don't think I'm going to make it. And by the time 911, the people got here, the fire truck was here, the ambulance was here. They wheeled me out on a gurney. And I was literally waving my last farewells to people because there were some people, some of our neighbors standing around, and they were watching and wondering what's going on. And I couldn't even talk. I could not say a word because I had no breath to express the words. And they got me to the hospital. They actually called a couple to find out which one could they get me into immediately. And they took me to San Joaquin, which is the only one that they could move me right into. And even there, I was sitting for 20 minutes. But they connected me with all kinds of IVs and were doing whatever they could to kind of keep me going. But it felt like I'm a scuba diver, and if I could imagine myself diving down to about 100 feet, actually more like 200 feet, because when you go down to a certain depth, you feel the pressure of the water on you. It's like something is squeezing you, and that's what I felt around my chest. And it also felt like somebody had just reached up to my air valve and turned off my air. And I was able to get just a tiny bit, but I could only take a small sniff of air, something like that. That was all I could do. And it wasn't enough to sustain me. It wasn't enough to sustain me in conversation, so I wasn't able to talk at all. And eventually I was admitted into this area in the hospital where they began more serious treatment. But I guess the best way to describe how it felt is it felt like I'm 200 feet underwater with my air turned off. And that was just not fun.
It sounds horrible. It sounds like a major, serious, significant illness.
It is extremely serious. And I think that's the part that I'm disappointed about, is that there are so many people who do not think of it as a serious illness, because there are people who not only get the disease and go through it with moderate problems. Some people go through it and don't even know they have it. They get it, they go through it, and they come out on the other side and never even had any symptoms whatsoever. They're called asymptomatic. And these are the people who could spread it the most, because assuming that they have good intent and that if they knew they had it, they would sequester themselves away somewhere. They don't know they have it, so they don't go and get tested. They don't stay away from people. They don't observe the 6-foot distancing. They don't wear the mask because they think, hey, I'm healthy. What do I have to worry about? But meanwhile, everywhere they go, they're spreading it to 2, 10, 15, 20, or whatever number of people. And those are the people who, in fact, could very well die from it, as I almost did.
Yes. So, Commandant, what treatment did you receive?
There are some experimental treatments that are going on, and I was very fortunate to be in a position that they offered those to me. One was, and I'm hoping I pronounced these correctly, so pardon me if I don't, but convalescent plasma was one. Now, convalescent plasma is when a person gets the disease and their body will build up antibodies to it. And those antibodies are in the blood. They can then donate their blood or their plasma, and those antibodies then can be transferred and given in a transfusion to another person who has the disease, and it will help boost their system so that they will start creating antibodies and they can fight that disease off a lot faster and more forcefully. So that was the first treatment. I had 2 days of that. And the second treatment I had, which is much more experimental, not approved by the FDA, but it was so dire that the FDA essentially, that's the Federal Drug Administration, they essentially said, if a person is on their last leg and there's nothing else you can do, and they're going to die anyway, well, then there's no harm in giving them this, even though the FDA has not approved it. So, and that was called remdesivir. So I did receive 4 days additional of the remdesivir. And they have no idea what the outcome is going to be. I may, I don't know, grow a third eye in the middle of my forehead next year, but because it's not been tested well enough that they know the outcome over a long period of time. But those 2 treatments were extremely effective in bringing me out of it. I spent 3 days in the ICU, and I spent 5 days after that in the hospital itself. And all of this, of course, was they kept all the COVID patients separate from everyone else. But it was a much more accommodating situation once we got into a regular room.
Wow. You had quite an experience. What about hospital care? What did the hospital staff do that helped you?
Well, of course, the first thing was giving me these 2 treatments, the plasma and the remdesivir. I think there were many, many other things they were concerned about too, because people who have COVID also sometimes will develop blood clots, and that can in fact kill you. So I was receiving a blood thinning agent to keep that from happening. My body was so weak that I could not get out of bed. Literally for 3 weeks I was in bed, couldn't get out. 2 of those weeks here at home, 1 week was in the hospital, and the bathroom was literally 10 feet away, but I could not get to it. I couldn't, once I got out of bed, the alarms would go off and the nurses would come rushing in. They were extremely attentive. They were extremely kind. They offered me whatever they had that they could give me. Would I like some water? Would I like some ice chips to kind of moisten my mouth? They had to come in every 2 hours and either draw blood or give me some kind of intramuscular or intravenous medication. So I had IVs in both arms. And I had a monitor device on my chest, which was monitoring my heart. And people may not know it, but the heart, the liver, and the kidneys can also be very seriously negatively affected by COVID-19. So after coming through all of this and being able to get out again, that was the first thing I had to do, is get to the doctors and have all of those systems tested to see what's going on. And I'm still waiting for some of the results to come back. But there could be heart damage, there could be liver damage, there certainly could be lung damage, and I've had x-rays and see, what do they call those things? They put you in the tunnel and send you through there.
Oh, a CT scan.
Yes, a CT scan. Apparently those work better than x-rays for situations like this, because the lungs can be damaged very seriously.
You're talking about damage that isn't usually made public, or possible damage to other vital organs.
I think a lot of this is they're just finding it out. That may be one reason it has not been made public. You see, in my other hat that I wear, I'm also on the news of one of the major stations here in town. So it's my job to interface with the health department and with other agencies and learn these things. What are you learning? What are you finding out? Because this disease is only, let's say, give it a year old. And that means they don't have a history to go back to. So there's so many things about it they're just now finding out. And that's the reason they had, at first they're saying, don't wear a mask, it won't help you. And then all of a sudden they came back and said, no, wear a mask everywhere you go. And then they said, well, wear a mask when you're around people you don't know. And because they don't know exactly how is this thing transferred. It is transferred in the air. It is transferred by touching surfaces. It is transferred by moisture and spittle and things that come out of your mouth as you speak. And they have done a lot of experiments lately to find out how far can that go. And that's why there's the 6 foot distance, because generally speaking, if you're 6 feet or more away, the force of the projectiles coming out of one's mouth are not strong enough to go beyond 6 feet. So you have a better chance of not being contacted by that material. Because if that material has any of the virus in it, it can get not only into your mouth or into your nose, but it can get into your eyes. You may not even see it. Someone could walk through the room who has this disease, they could sneeze and continue on out of the room, then you come through the room 20 minutes later, not knowing that person went through or that they sneezed, but that mixture is still in the air. And you walk through it just casually walking, but your eyes are open. It can get in your eyes and you can be infected. You can be affected that easily. And this is one of the reasons people are saying, well, look how many people got the flu and we didn't do this or that. Well, this is a little different than the Spanish flu, the flu of 1918. It is much more infectious, and the consequences are much more severe because of all this organ damage that can happen. So now they're learning about that organ damage, and they're just beginning to mention that, but the major media hasn't picked up on it, so we don't hear a lot of that on the news. We hear 3 more people died, 244 people were infected today, but that's all. We don't hear that this person has recovered from the disease, but he has severe lung damage that will never be recovered because that tissue was killed. This person has lost a kidney. This person has lost some other part of their very important systems. And what they're learning now, the most recent thing that came out, which I do stories on these things and I try to tell everybody, but of course everyone does not listen to one station. But what they've just learned is it also can affect your brain, and it can be fatal. It can get into the blood system, get into the brain, even though there are barriers there that try to keep viruses out. But this disease has gotten through some of those and to some people. So it is an extremely, I can't stress that enough, it is an extremely virulent disease that those who get it and survive it are extremely fortunate, no matter what their age. They were also saying it was only the older people we had to worry about. And now we're finding 5-year-olds, 20-year-olds, 17-year-olds, athletes, people who are in the prime of their life and of their health, who are dying, not just getting sick, but who are dying from COVID-19. So we're just learning, and that's part of the problem. We can't say anything, no, not we the media, I, the patient, they, the doctors, can't say very much because they just don't really know how far this thing can go.
So when you tell people that you had COVID-19, how do they react?
Well, there are some that like to stay in the next county. they don't want to get close to me because, and especially now, as you notice, I've got this air tube going on. That's one of the holdovers that I have. My lungs were affected to the point where my breathing, I'm still learning how to breathe again. And 2 weeks ago, I could not have had this conversation with you because I couldn't have talked long enough to continue it. I'm getting much, much better day by day. I'm seeing improvements, but I still have to have oxygen 24 hours a day. So I have an oxygen generator here in the house. I have portable oxygen tanks that I carry with me if I leave the house. And I have another oxygen generator at work so that I can continue that supply and keep my oxygen in my bloodstream high enough that I can function. Otherwise, I walk 5 steps, 10 steps, and I'm completely out of air, and I have to stop and sit down and rest.
This sounds like a horrible disease, much worse than most people are aware. What do you think are the things that people need to do to avoid getting COVID-19 or to help others avoid it?
I think there are some things, and the operative term here, I think, is to help or to try, because I don't know that there's any way that we can totally avoid it. If so, I would readily jump on that and run with that. But the only things that we can do is try to limit our ability to either get it or to give it. Now, the one misconception about the mask is the mask, if I put on a mask, which I do, I wear one wherever I go once I leave the house, but that mask is not to help keep me from getting the disease because they don't work that way. I wear the N95, which is able to stop particles up to 0.06, but that's only going to stop me from spreading it if I have it, which I don't, by the way. I've been tested and I no longer have the disease. But if I did have it, or if I were to contract it somewhere else, it would be 2 weeks before I would know, because that's how long the incubation period is. So during that 2 weeks, I could come over to visit you, I could come to visit some of our other soldiers, or I could be giving a speech somewhere, and everyone that I'm within 6 feet of could potentially, I could infect them. So I wear the mask in order to keep any particles from coming out of my mouth that may potentially have the virus that would affect anybody else. And the same thing, so in other words, we should wear a mask. That's the first and most important thing that we should all do whenever we're outside among other people. And it is not to protect us from them, it's to show the respect that I am trying to protect you from me in case I have something that I don't even know I have. Because wherever I got it, I'm sure that person or that item didn't know it had it, so it didn't hold up a sign and say, hey, stay away, I got COVID. That didn't happen. But if that person had been wearing a mask, I may not have had it. If that person who sneezed in the room that I walked through had been wearing a mask, the mask would have captured those particles instead of me capturing them. And the second thing, of course, is things that you touch. So another thing that we can all do and should all do is sanitize everything that we touch. When you go to work, don't just sit down and start working. Get out your little Clorox wipes or whatever and start wiping everything down, because you don't know who else may have come in when you were not there and touched it or used it, not intending to cause a problem, but again, they don't know they have it, so they're spreading the disease. So we wipe everything down, the mouse that you use when you're at your computer, the keyboard, the phone. And then the third thing that we do is we sanitize our hands, and we wash our hands frequently. Every time we come past a faucet that has soap, we turn on that hot water, we get some soap on our hands, and for a good 45 seconds, you start scrubbing in between the fingers, around the thumbs, make sure that you've covered your entire hand. And I think those are the things that are most important. Wear the mask, sanitize, and wash. And of course, the 6-foot distance, I think, is also very important.
Yes. And what about testing?
Testing, I guess right now, my problem with testing is that it takes so long to find out. You go in to have your test taken. When I went in, it took, I think it was about 7 days before I got the results. And during that 7 days, I'm still going to work and doing whatever I was doing, not having a clue that, uh-oh, I got a little bug in here that's leaving a trail every place I go. So I think that's the biggest problem, is we don't seem to have a fast enough return on the results so that you get tested, and before you can walk out of that building, they say, hey, oh, you got to go over here and be quarantined because you got it, or you're good to go because you don't have it. But testing is certainly a very important thing. The more we test, the more we know where it's going, and hopefully can figure out how it's getting there, so that we can put things in place in our society that will allow us to curb the travel of this germ, this disease, this virus.
Yes, and we can't predict if this is the only new virus we're going to find.
Well,
So,
it not only, you're absolutely right about that. And another part of this virus that I have not mentioned that I would like to is a virus has the ability to change, so that it will adapt to it's like the Marine Corps, adapt and overcome. So you find one way to stop it, it's going to find another way to overcome whatever block you've put in its place. Now that means two things to me. It means, first of all, it's going to take us a little longer and a little harder to catch up with it and try to stop it totally, if we can. We've not stopped the common cold. We've not stopped the flu. So, and their viruses, I don't know that we can stop this one either, but we can at least make it something that we can live with that won't kill us. And the second thing about it is its ability to change and to adapt to new circumstances means that if I have one strain of the coronavirus, which is the one that I had, who's to say that I can't get another strain? The doctors don't know. They're thinking it's possible. I might have a 6-month immunity. might have a lifetime immunity. But this whole thing about herd immunity, frankly, I think is a bunch of hogwash. I do not see that happening. Where's the herd immunity to the flu or the cold? We have not developed it because the virus can replicate itself with one little genetic strand that's different, which allows it to survive, and you get it again. Or you get his twin cousin who looks like him, except he's got shorter fingernails. I mean, it looks so similar, it is so similar, but that one little change can make a world of difference. So we need to be realistic and not be political, but be scientific about how we approach this.
Yes, thank you. For you personally, do you have any way to know what your anticipated recovery time will be?
Not really. I couldn't even find out how long I'll be on oxygen. I was asking my doctor this just the other day, and I'm getting better, and I can do more, and I can do it longer. So I'm thinking, hey, I must be coming close to the end of this thing. And he says, well, we don't know that. You know, A, you could be on it for another month or two, or B, you could be on it for another year, because there are people that have been on it for 6 months. Or I could get off of it, everything could be fine for a little while, and then kaboom, all of a sudden it sort of starts growing up again. Not a different virus, but the very same one that knocked me out before can come back with a vengeance, because we don't know the long-term effect that that virus has on the human body.
You know, there's conversation about a vaccine being developed, maybe actually several vaccines. And it
Yes.
sounds as if you had very good medical care. Have your physicians talked to you at all about these vaccines?
Well, they are not really the people that I talk to. I did talk to experts about that, but not to my doctors, because they are not involved in the process of making these vaccines. But I reached out to the companies that in fact are trying to develop these vaccines. And there are, I think, about 6 or 7 different companies around the world that are trying to develop a vaccine. And they're all in various stages. One of them is giving out the real vaccine to some of its people, which is how they do the controlled study. And then some of the people get a placebo, which is something that looks like it, smells like it, but it isn't it. And one person of that whole group has already gotten the disease. So I don't know whether, I've not been told yet, whether that was a person that was given a placebo or if that was a person that actually got the real vaccine, but they're still working on it. And the best word, and this comes from Dr. Fauci in New York, the best word that we can get is hopefully by December, we may have a workable disease or a workable vaccine. There are people whose names I will not mention, but there are people who have said that there should be one out before November. That, in my opinion, is a political statement and should not be cared. We should not pay any attention to it. That's somebody that's trying to say, well, before the next election, you know, this or that will happen. But I think we need to, again, look at the science and not look at the politics behind it, and realize that it's going to take a while for them to develop this and to vet it, to make sure that it works, so that it's not going to cause more problems than it solves, and that it'll do what they say it'll do.
You have done a wonderful job informing us. I frankly had no idea how serious it could be.
There's one thing, if I may, Lieutenant, that I would like to toss in. I just want to make sure that we're perfectly clear about one thing. I am not a doctor. I am not a scientist. I don't want anyone, I know I speak very strongly about it because I believe very strongly. I've gone through this thing, and I'll be doggone if I want to go through it again, or if I want anyone else to have to go through it. So I'm extremely passionate about it. And I have my beliefs, which are based on study and interviews that I've done with people. But I am not a doctor, I am not a scientist, and I hope the people who are listening to me understand that and realize that I am a patient. I am the person who had the disease, and thank the God above, overcame it to the point that I can still be here with you now. But don't take my words as scientific. You are hearing my opinions and my opinions only.
Thank you. Do you have a message that you would like to be certain people hear about COVID-19?
Absolutely. And I've kind of bumped into it there a minute ago, but my message to you would be, do not allow a blue tie or a red tie to sway your decision as to how you comport yourself in our community with your brothers and your sisters and your fellow Americans. It's not a political thing. So no matter who's talking to you, who you're listening to, don't take the political attitude that, well, this is good or this is bad, or I'm not going to do this or I'm not going to do that. Look at the science. Listen to the health officials. They are wondering why there are people out here who say, there's no such thing, I'm not going to wear a mask, you're infringing upon my rights, and so on. Why are people doing that when someone's life is at stake? And I've asked people like that, I've said, you want to be the first one to volunteer to take the COVID and see if it killed you? And he says, well, hey, if it's my time, it's my time. Well, what if it killed your grandmother, your father, your wife, your kid, the person that you love? You get away, but it killed somebody because you brought it to them. Then how would you feel? And I think those are the things we need to consider, the reality and the severity of this disease. And how would we feel if we are responsible for transmitting this and literally killing the person or people that we love the most? And I think that should be enough in itself to tell us to be careful and to listen to the truth and to the science. Don't take a political position just because you think it's popular.
That's very well said. And obviously, because of COVID-19, we are remote from each other while we're doing this podcast.
Absolutely true.
Yes, we are very concerned. And I thank you so much for information about this disease. It's horrid, and I'm so sorry you had to go through that. But thank you for sharing.
And I thank you for giving me the opportunity. And if my going through this opened a door and an opportunity for me to pass along some thoughts to other people that will keep them from going through it, then it was worth it.
Thank you.
Thank you.